Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is December 11th, 2020. As always, we start with the COVID-19 statistics. Worldwide, we have over 71 million cases and over 1.6 million deaths. In the United States, we have over 16 million cases and over 301,000 deaths. In the U.S., we had our first day this past week of over 3,000 deaths. We're now seeing over 15,000 deaths each week. We've also hit over 100,000 people currently in the hospital for COVID-19. This means that many hospitals are currently over capacity for space, and even more are over capacity for staff. Because of that, not only are some people with COVID-19 not getting adequate care, but many of the routine procedures are also not able to be done. This includes cancer and other screenings, which could result in diseases like cancer not being diagnosed early enough to actually save people. This country's lack of an adequate response to COVID-19 early on has caused tons more suffering than it should have. It's too late to save those who have already died, but please follow the CDC guidelines in order to prevent thousands more deaths. More and more healthcare workers, teachers, grocery store workers, and others on the front line are asking for mask mandates in their states. As we've mentioned before, the evidence is overwhelming that masks work, and studies have also shown that the economy does better with a state-level mask mandate than either no mask mandate or a city or county-level one. High mask use can also help us avoid more drastic measures like curfews, business closures, and lockdowns. The CDC this week made it clear that masks should be worn anytime you're out in public, whether you're outside or inside anything. They've said as much before, but they wanted to be sure that everyone understood it clearly. We went over the guidelines last week and in many previous reports. Please watch those for more information. As we mentioned last week, the surge in infections due to Thanksgiving has now started. We're seeing a definite uptick in cases, but that will likely increase even more over the next couple of weeks. Deaths are already starting to increase, though most likely that's not because of the Thanksgiving holiday. The next 2 to 3 weeks will almost certainly see a spike in deaths due to Thanksgiving. The CDC and nearly all public health departments throughout the United States are pleading with everyone to stay home for Christmas. We all think it won't happen to us, but people are dying because of holiday gatherings. It does happen, and it could be you or someone you know. Please don't take the chance. Use virtual solutions for now. Like we mentioned a couple reports ago, Zoom, Microsoft Teams, Skype, WhatsApp, Viber. There's all sorts of different things that you can use to join together through video calls, texting, voice calls, etc. We know that this isn't what anyone really wants. We would rather have the physical gatherings, but no one wants to die or become seriously ill either. We're basically begging here. Please do not gather physically for Christmas. In good news, a COVID-19 test has been developed that works in conjunction with a smartphone camera. It gets results in as little as 5 minutes and is highly accurate. They're still working on getting it to the point where it can be mass-produced, but it could be a major game changer if they're able to get it out quickly. In vaccine news, the United Kingdom, Bahrain, and Canada have all approved Pfizer's COVID-19 vaccine for use in their countries. The United States, one of the FDA panels, has recommended authorizing it, but the official authorization is likely to happen by Monday or maybe Tuesday. That's the estimates right now. Moderna's vaccine is likely not far behind. The research for AstraZeneca's vaccine was peer-reviewed this past week, and it seems that though there were concerns, like we mentioned last week, about the way the studies were done, the review was overall supportive of the end results. It's still unclear if countries will require further testing before approving the vaccine. All studies so far on COVID-19 vaccines have dealt with adults, just because of safety limitations, etc. But Moderna is now starting a study to determine if their vaccine would also be safe for adolescents. They're hoping to finish that study by spring of 2021, so that all the results and approvals and everything else that's needed will be ready by fall of 2021 before all the adolescents and children go back to school. The UK has reported 2 people having a severe allergic reaction to the Pfizer vaccine. And they're warning that those with a history of severe allergic reactions, like these two people had, should not get the vaccine just yet. They're currently investigating what caused that allergic reaction. They're not even sure at this point if it really was the vaccine or if it was something else coincidental. Still under investigation. As with any vaccine, there are some possible side effects. Like we've mentioned in past reports, the side effects for these vaccines have been very minimal for almost every single person, and pretty much for everybody, just about everybody at least. The benefits far outweigh the risks. In the actual testing for the Pfizer vaccine, out of nearly 20,000 people that were in the test, only one had a severe allergic reaction. So it's pretty rare. For the time being, if you regularly carry an EpiPen, or you should be carrying an EpiPen for your allergic reactions, don't get the vaccine, even when it becomes available. Let's wait, allow the investigations to go through, make sure that everything is safe. Most likely, they'll find a way to get it so that it's safe for everybody. If that doesn't happen, then it'll become even more important that everyone that can get it gets it. That way the herd immunity will be able to kick in for all of those people, thus protecting the few that cannot get the vaccine. A COVID-19 vaccine out of China recently finished its trials, and it was announced that it's 86% effective. That's promising, but the actual data has not yet been released so that it can be peer-reviewed and confirmed. If the data does end up supporting the 86% effectiveness claim, that'll be a huge step for getting the vaccine to many countries that can't afford the Pfizer or Moderna vaccines. This past week, the director of National Institutes of Health, or NIH, Dr. Francis Collins, asked churches to do the right thing and use remote services as much as possible. Religious freedom is extremely important. We don't want to stop any church services, but churches are also some of the biggest spreaders of COVID-19. There have been a number of super spreader events because of church services. So what we're asking, including pretty much all public health entities, we're asking for church leaders to voluntarily take steps to limit the spread. That includes remote services. In cases where remote services aren't possible, that means limiting the size of congregations, doing the social distancing within the building, using face masks, all of that. Please, churches that they were in the list of some of the top 4 places where the COVID-19 is spread. And so please voluntarily take those steps. In other news, we have a couple of recalls this week. First, Publix has recalled holiday cookies sold in its stores. This isn't because they're contaminated with anything or any bacteria or anything like that, but because the labels are missing information about the cookies possibly containing pecans. So if you're not allergic to pecans, feel free to enjoy the cookies, no problems. If you are allergic, however, please see the link below the video for more information. The second recall this week is for a specific type of candle sold only at Dollar Tree stores. There's a chance the glass could break around the candle, causing a fire hazard. Please see the link below the video for more information. Thank you for watching the Plain English Public Health Weekly Report for December 11th, 2020. As always, the links below the video have additional information we weren't able to get to today, and even more information on what we did talk about. The first 2 links after the COVID-19 statistics link are the most thought-provoking and provide a lot of good information, and I strongly recommend reading them. I'm Richard Greenland, and you have a healthy weekend.